Today, we learned 13 healthcare workers in Minnesota have tested positive for COVID-19. State health officials say the workers did not get the virus on the job, but from travel. They are not all at the same facility. At an afternoon news conference, Governor Tim Walz says days matter, and staying at home when you do not have to go out will save lives.
There's things we're going to have to do, and we're asking a lot of sacrifice, but it will be worth it. It will save lives, and it will allow us to return back to normal in a much faster manner.
For the first time, some grocery stores are now limiting the amount of some foods you can buy. This Kowalski's put up signs saying 2 per customer. We know that meat, eggs, and bread are in short supply at many stores. Pasta is also a hot item, along with cold and flu medicine. And good luck finding toilet paper. This Target in Apple Valley didn't have any paper products today.
Hair salons, nail salons, and other spa-like businesses are closed for business. This comes as many restaurants and bars have transitioned to curbside pickup. The state's cosmetology board says that salons and spas should remain closed until March 27th. Minnesota now reports 77 confirmed cases, Wisconsin 106. We should note that guidelines have changed for those who get tested, so these numbers are likely much lower than the true number of cases. The governor today said they have frozen more than 1,700 samples. Some nurses say that the state is woefully unprepared to deal with COVID-19.
Representatives from hospitals across Minnesota today gathered to share their experiences, express their worry, and demand a better plan. WCCO's Jennifer Mayerle heard their concerns.
Every day, these nurses say they go to work exposing themselves to risk.
The tension in the hospitals and the fear is heavy.
They're on the front lines of this pandemic, says the Minnesota Hospital Association president.
Now we have a new threat, and it's the nurses and the healthcare workers that are marching into battle.
These representatives say they'll continue to answer the call well unprotected. A survey of 1,000 members showed more than 50% believe their facility is somewhat unprepared or unprepared to respond to COVID-19. They say they need better patient isolation areas, more education, increased communication, and proper personal protection equipment. They demonstrated the N95 mask that's in short supply. Instead, many say they're forced to wear a less protective surgical mask.
In the event that a patient were to be positive for COVID-19, we're not protected.
As of Wednesday afternoon, 13 healthcare workers tested positive for the virus in Minnesota, but the health department reports the cases are travel related. These nurses believe it will get worse.
There are no processes in place to deal with employee exposure.
They're making bold suggestions.
We are not addressing this fast enough. We need to be opening up major public facilities like the Xcel Energy Center and the U.S. Bank Stadium to become ancillary hospitals.
And want a seat at the table.
We need answers on what to do and how to deal with these patients. And number 2, we need to pull together as a community.
Jennifer Mayerle, WCCO 4 News.
The nurses are asking for a meeting with the Minnesota Hospital Association in the next 5 days. The Minnesota Department of Health said it is working with the healthcare system to ensure that those on the front lines have what they need to protect themselves.